what effects does it have on the body, and the diagnosis and treatment of sickle cell. What is sickle cell? I know many of you have heard this in your classes and all of that, but how many of you actually know what it is? Sorry,
It's a disease.
I just said that. Yeah.
Isn't like a disease of the blood?
Yeah, that's basically, based on RealStrong.com, sickle cell disease is a serious blood disorder within the red blood cells that causes acute pain, severe anemia, infections, and vascular blockages that can lead to widespread organ damage and or death. And here's a picture of how a normal red blood cell look and a sickle-shaped blood cell. And the normal hemoglobin inside the blood cell, which keeps that shape, and abnormal hemoglobin, which makes the shape sickle. And here's a video that touches on what I just said.
What is sickle cell disease?
Sickle cell disease is a common inherited blood disease in which the red blood cells, which are the cells that carry oxygen from the lungs to the rest of the body, behave in an abnormal way because they contain an abnormal hemoglobin molecule.
Normal red blood cells are soft, smooth, and flexible. They are donut-shaped and move easily throughout the body. Sickle-shaped cells move awkwardly and block small blood vessels, causing less blood to reach these parts of the body. These sickle-shaped cells can cause serious health problems for those affected.
And we acknowledge YouTube for that, right, Sha-King?
What happened?
We acknowledge YouTube for that, right?
The three main types of sickle cell disease based on Children's Mercy is sickle cell anemia, hemoglobin SC disease, and hemoglobin SV. There's more, but these are the three main types. Sickle cell anemia, based on Children's Mercy, is also known as hemoglobin SS disease, most common type of sickle cell disease, and people with this type of sickle cell only has two sickle cell hemoglobin genes and no normal hemoglobin genes. Hemoglobin SC disease is the second most common type of sickle cell disease. It's usually a milder type than sickle cell anemia, and people with this have one sickle cell gene and one hemoglobin C gene, which is another type of abnormal hemoglobin based on Children's Mercy. And SB, also known as thalassemia disease. Also one of the most common types of disease, just like anemia. And people with this has one hemoglobin S and one gene beta thalassemia, which is another type of hemoglobin disease. And how it affects the body. Pain. Sickle cell causes pain, which is caused by the clumping of the sickle cells in small blood vessels. And poor growth. Tissue don't have enough energy to support the growth since sickle cell, since the red blood cells carries oxygen to the body in the sickle cell, and inside the sickle cells, inside the cells is oxygen. The hemoglobin is the oxygen inside the cells which carries it to the body, and the sickle cell has all abnormal hemoglobin which doesn't support enough oxygen to the body. Vision problems caused by clogging of tiny blood vessels of the eye, which is strokes. It also can cause strokes, which is by blockage or burst of blood vessels in the brain by clumps of sickle cells. And organ damage caused by the clumping of sickle cells and the lack of oxygen to the organs, which is based on RealStrong.com. And diagnosis treatment. It can be diagnosed by a simple blood test called hemoglobin electrophoresis, which determines whether the person has sickle cell disease or is a carrier. And the treatment is a daily dose of penicillin to protect against infection, a daily dose of folic acid to build new blood cells, plenty of rest, drink a glass of water, avoid too much physical activity, and blood transfusion to provide healthy red blood cells. In the more severe cases, like not if you're in the hospital stuff, they would do a bone marrow transplant to provide fresh blood cells, which is based on learned genetics and research. And in conclusion, I've went over the different types of sickle cell disease, how it affects the body, and the diagnosis and treatment. Any questions?